There was chaos at a Yeoville, Johannesburg clinic as residents and Operation Dudula members blocked foreign nationals from entering. The standoff was sparked by a viral WhatsApp message calling on the foreigners to gather after the borrowing of their compatriots from other public health facilities. The South Africans got wind of this and also arrived, and as a result, parents were left pleading for their children's rights to treatment. ENCA's Theodore Mashele reports.
In the heart of Yeoville, a small clinic became a stage for a bigger national debate.
I said today the situation is very tense.
Who is entitled to treatment when facilities are stretched to the limit?
The issue of illegal immigrants who comes to a country as per Immigration Act of 2002, it states clear that he must seek a medical insurance from the Director General of Home Affairs. Say I'm going to seek for a medical care in South Africa, then the Department of Home Affairs will then issue a medical insurance, which state clear which is for 3 months, and then it will go back home.
Healthcare officials hit back, invoking the Constitution and slamming the blockage as an attack on basic rights.
So we have problems when you get a child. For example, a child died in Alexander, where the child was denied access and the child died outside the clinic, where we had a group of people who were denying people access. Number one, you have no right to actually deny a person to access healthcare. It's healthcare, and it's there in the Constitution. If anyone has a problem with that, they need to go or follow the right route, which is for them to ask or to even go and march at Home Affairs.
Meanwhile, desperate foreign nationals beg not to be turned away.
Because I've got a permit. I've been here for 20 years. But now they're even refusing for someone who's got a permit to go inside. So what must we do?
They don't allow anyone to get inside. But tablets are being sold here in front of the gate, right in front of the gate. What about this lady who is in charge of this clinic? What is he saying?
There is no access here. There's another Congolese guy here. I think he was here for treatment for TB. He's being called a Nyamazan. What's a Nyamazan? What's that?
Who's calling him that?
There was some man who was calling him Nyamazan. Why is this Nyamazan standing here in the lines?
As the standoff deepens, the question remains, in a strained system, who gets to decide who qualifies for care?
There are issues with other clinics. The foreigners are blocked from entering, and when they are blocked, now they are all flocking to Yeoville. Upon them flocking to Yeoville, the residents, they said, no man, when we come into Yeoville clinic, we find that our clinic has run out of the stock of medication. So what we are going to be doing is to make sure that we block everyone from coming in. And I have been trying to re-emphasize that this is just the communities from all the political affiliations. Others are not even politically affiliated. It's not about Dudula. But outside there, it has been made to be saying Dudula is blocking the people. But what really sparked the issue of today is the voice note which was circulated yesterday, which was calling all foreign nationals from across the length and the breadth of the city of Johannesburg to come and gather here. Fortunately, I was able to meet the gentleman. This is the gentleman who had made that video. We spoke with them. We spoke with the leaders of EFF. We do have Dudula here. You understand? So we've got a number of the stakeholders. Mine was to say we can have a way of finding solution without necessarily fighting with one another.
So residents that daso ba kwatile ba tletse psinya ba re undocumented foreigners ba tla daso ku di facilities tsela ba fetsa medication ba fetsa ditlhare bona banong ba jika di residents tsa mo South Africa ba tliste bana di check up a ona ditlhare so ba decide manyora ba daba re bona ba tswa se Operation Dudula ba fitha ba ema mo gate daso a check passport daso rena le yona are you documented ona le necessary documents na ya he ba bona ngare a ona dilo mara accent o ikela kwa wa jika ba gare e re 60 ba utla 60 ba tlhaba ka setlhako bolla morao ba botsa re clinic yo ka screen medication tsa more ka speito te peite ya medication o lo kwa mo ka South African fela ba tla rile ba foithu ba thibile gate so go Yeoville ba bona re shubile ba tsena ba fonela mahata hata ba fitla daso ba try to understand the situation aba sa utlwisisa residents tsela ba re ya bona ba lapile operation dudula e ba kubile go ditliniking so no ba tletse go clinicing ya go Yeoville e shubile go massive ba fotsu
Bathini nama boys current situation eYeoville njengoba nibona nje kunjani eYeoville ama foreigners azo attack ama South African njengoba nibona ma command yeah, so they are mobilizing themselves ukuthi bazongena ngenkani esibhedlela. This is the current situation eYeoville. Commanders wonke umuntu akasondele eYeoville, all commanders eYeoville police station. Morning. Yeoville clinic.
To happen at this facility today?
What's going to happen today, we continue with what we have been doing the whole week. We are still going to conduct a queue of prioritizing South Africans on the lines. We are using the Section 17 saying that we are prioritizing South Africans to get free medical help and excluding the foreign nationals because we are prioritizing them to be the ones that are first in line and getting what is rightfully theirs because now we sit with the problem with that South African people come to the clinic and they never get the help that they need because their foreign nationals come and they flock the clinic and then when our people come, they can't get the help. We've never had an issue where the clinic runs out of Panado, a simple Panado they can't get because these people, they come in, take medication, send it back home.
Bali, we know that the National Department of Health and the South African Human Rights Commission has called what your organization is doing unconstitutional because everyone, irrespective of their immigration status, should be able to access health care. What do you have to say about that?
Well, what I can say about that is there's nothing that they're doing for South Africans. They're not doing anything for South Africans. It's more like we are crying out loud and no one is saying anything about us. No one is looking after us. So if the government is not looking after the South Africans, then we have to look out for each other. So we'll continue doing what you're doing until the government and the president hears what you're saying. And the Human Rights Commission, they have to prioritize us as the citizens because we are South Africans. We are the ones that vote.
Bali, there's many pregnant women that are coming to this clinic, many young babies that are coming through for assistance, and they're being denied medical treatment. Do you not think this is inhumane to deny them access?
Nobody's denying them access. There are private doctors, there are private hospitals. They can go there. We are saying government clinics are for South Africans. If they want to get help from the doctors or hospitals, there's a Netcare, there's the private doctors. They are more than welcome. We can even refer them to the best doctors in the area. They can go there.
Hey guys, welcome back to Everything Entertainment. Guys, please don't forget to like, comment and subscribe to my videos. I will appreciate it. Guys, please watch the ads, my beautiful people. Please watch the ads. Guys, in today's video, we're gonna be speaking about the situation that is happening in Yeoville. So apparently what happened is that, guys, there's a foreigner who literally sent a voice note to foreign national informing them like if they want free health care, they must go to Yeoville clinic because ever since Operation Dula has evicted them in public hospitals around Johannesburg, Yeoville is free, doesn't have a lot of patients, so they must go there and get free health care there. So foreigners continue to go there and they finish medication. South Africans were literally not able to find medication in Yeoville clinic. So that is why South Africans right now have taken upon themselves to literally not allow foreigners to have free health care in Yeoville. It is going down, Sana. South Africans are hardful. Like, they are hard for at this point. So they have called the police to come and intervene. And guys, I'm asking myself this question, like, why is the police not arresting illegal foreigners right on the spot? At this point, guys, this should be a change. They should arrest illegal foreigners. The Home Affairs must be there as well. Because of in South Africa, guys, this thing like illegal foreigners are in our country. It has been normalized so much that the police will come to help them as well. So why is the police not arresting illegal foreigners? This country, it is so, like, it's a mess. I don't want to lie. This country, it's a whole mess. And tell me why are they fighting so hard to receive free healthcare in South Africa? The same energy that they're fighting right now to receive free healthcare, they should be fighting their own countries. Like, I don't get it. Because apparently right now, foreigners are there, like, going back and forth with South African to say, yes, we want healthcare, all those kind of stuff. It is so diabolical to me. You're not getting free healthcare in your country and you want to get free healthcare in South Africa? You must be crazy. Like, think about it. It does not make sense at all. Guys, like, for the fact that like Yeoville clinic didn't have essential medication like Panado, that is crazy. I told you guys, I spoke about the Lesotho incident whereby Lesotho didn't have essential medication for their citizens. Now it is happening to South Africa because of why? Illegal foreigners. Sanalwam. This is a pandemic. It's a pandemic because of what the heck? I understand the frustrations of the people of Yeoville. I understand them so much, guys. What do you mean, guys? It doesn't mean good, like these people cannot afford to go to private hospitals. No, they can afford it. They are working in South Africa. They think we don't know that they are working. Just that they're spoiled so much to receive free stuff from our country, stuff that they shouldn't be even receiving. So now that South Africans are standing up to say, no, you guys are no longer receiving free healthcare in our country. They are stubborn to accept the new change that South Africans are fighting for. So right now, it's like, South Africans, we are being inhumane. Like the journalist is asking that lady Kuti, like, do you think it's not inhumane for you to not give people free healthcare? Is it not inhumane in Nigeria to do that? Guys, no. Our resources are getting depleted by foreigners, and that is the whole truth. Guys, imagine a whole medication not being available for South African citizens. That is so diabolical. Where is that money gonna come from? From our taxpayers' money, and some of them, they don't pay tax. That is the truth. They don't pay tax. Guys, this one, it's so crazy. Guys, South Africans are so tired. We are tired to the core. Honestly speaking, we are exhausted with what is currently happening in our country. It's like these people want to take over our country. Like, what's happening? Imagine as a foreigner, you are making a voice note to recruit your people to come and deplete our resources. Aren't you ashamed of yourself? Why are you not fighting in your own country to receive the same free healthcare? Why are you not doing that? Guys, now honestly speaking, what I see here is absolutely great. Like, they are working. Why are they not going to private hospitals? Why? Private hospitals are there. They are waiting for them. Hi, Sana, this is so crazy. Sana, I don't know what the police are gonna do there. Are they gonna arrest Africans or what's going on? Because of the real people that they should be arresting, it's illegal foreigners there. It's them. Because of in this location like Yeoville, guys, we have a lot of squatter camps whereby that's where illegal foreigners are situated. So it's their chance now to prove that they really love this country. Let them arrest illegal foreigners first. Then we'll see what's gonna happen. Because wow, some we're gonna end up like Lesotho. If we are not careful, we're gonna end up like Lesotho. Imagine, guys, I'm so shocked. I don't wanna lie. I'm shocked. A whole Panado is not available in a public facility in South Africa. Guys, Panado. That is crazy. Mr. Julius Malema will never understand the situation. I get because he's using a medical aid. I get he goes to Mediclinic, he goes to Melomed, he goes to Netcare, he won't relate. That's why he's fighting so hard for foreigners to receive real care in South Africa. Look now, South Africans cannot get the same medication that they are paying for through tax. Wow, it is so sad. It is so sad to see a party like EFF fighting tooth and nail for foreign nationals while they are doing this in our own country. Guys, in other countries, this wouldn't even be happening. The government of other countries, they care about their citizens so much. They wouldn't even hesitate to literally do everything for their citizens so that they can be comfortable. But in South Africa, it's other way around. Foreign nationals are more comfortable than citizens of South Africa. Let's be honest. It's like that. It's like Rona, we are the visitors of this country. South Africans must stand with foreign nationals fighting for the same rights. Like these two people are not the same. We are South Africans and they are foreign nationals. They are visitors in our own country. So we should fight for the same rights, guys. Make it make sense. Make it make sense. Wow. I'm so shocked. But Sana, please comment down below what you guys think about this video, guys. I just hope Kuti what is happening in Yeoville will never even turn into something that is big, like violence and also ever. I just hope Kuti whatever that is going on there, I just hope Kuti South Africans will be able to receive their medication, and foreign nationals should go to private hospitals. Honestly, that's fair. That is what they are doing in their countries. Foreigners in their countries are going to private hospitals to receive healthcare there, so it's fair for them to do the same in South Africa. It's only fair, guys. So yeah, and that's on that. So please comment down below what you guys think about this video, guys. I love you guys so much. Thank you guys so much for your support. I really appreciate it. Please, I'll see you guys on my next one. Bye, guys.